is Rita Albach, presenting my Capstone final project for HSA 4938 with Dr. Christopher Miller, entitled The Coding Director, Successfully Managing a Coding Department in a Competitive Industry. What is medical coding? Medical coding is done by medical coders, and it consists of abstracting information from medical records. The information abstracted is then translated into alphanumeric and numeric codes to be used on insurance claim forms for payment purposes. Coding is also used for statistical reporting. So who leads the team of medical coders? The coding director does, of course, a type of health services administrator. The coding team is responsible for meeting the healthcare organization's mission. The coding director analyzes industry data routinely and uses the data to address the needs of the coding department, including hiring, training, and employee retention. Staffing has become a real challenge for the coding director because the medical coding market is growing. AAPC, the American Academy of Professional Coders, reported more than 200,000 members to its organization, with more than 161,000 of those being certified in fiscal year 2020. That rivals the number of employees the fast food giant McDonald's reported globally in the same fiscal year. The growth coincides with an increase in licensed practicing medical providers. The growth is partially responsible to the Affordable Care Act, creating more accessibility to healthcare, thus creating the need for more skilled professionals. The coding director uses the industry data to determine whether to hire uncertified coders versus certified coders, and also to set department salary. According to the AAPC, medical coders typically make about $54,890 a year, which is up about 5.8% from last year. The survey from AAPC also showed that certified coders bring in about 33% more than non-certified coders. Hiring isn't the only challenge for the coding director. High turnover is a real problem. Employee retention is an issue the coding director should be proactive about. Many coders expect to work from home and have a great home work-life balance. The AAPC salary survey also reported that 23.2% of survey respondents work from home at least some of the time or all of the time. This is important for the coding director to consider because having to replace a coder can be costly and time-consuming, since it takes usually around 45 to 90 days for even the most experienced coders to settle into a new role and to meet their full accuracy and productivity potential. There are also financial considerations when hiring and retaining good coders. Some of those considerations are professional membership dues, training and education fees, and the cost of code books and work supplies such as encoders that a coder replaces yearly, and it could cost a coder hundreds to thousands of dollars out of pocket if not supplied by the employer. Additionally, not supplying these crucial items could affect performance. The overall goal in training and keeping skilled coders is to achieve accuracy. The OIG recommends a 95% accuracy, which means the percentage of coding that is correct. Because the coding director is also responsible for the coding compliance plan, the director is responsible for training the coders in the department to train the medical providers to code. Research shows that most medical providers are not properly trained or educated on coding before going into practice and billing for services. Performance issues are a real problem, and ineffective management by the coding director could lead to an ineffective coding department, but it could also cause problems downstream, such as overcoding and undercoding. Overcoding and undercoding can lead to denials and incorrect payments. Denials can cost $25 per claim to work out, and denials are usually not followed up on, leaving revenue lost. In summary, the coding director, as a health services administrator, plays an important function in the healthcare organization. And effectively managing the coding department is crucial for a smoothly functioning organization.